apnea, as somebody just introduced, is a very uh, important and dangerous condition. People underestimate this problem both in India and USA, and that's why I thought this will be a very good platform to introduce this topic. So, what is sleep apnea? What happens when you are sleeping, mainly in deep sleep, which we call REM sleep? All the upper airway muscles they collapse and block the airway. So your body oxygen drops because there is no air going to your lungs. As soon as the oxygen drops, your brain wakes you up from your deep sleep and puts you in light sleep, and then the airway opens again, and this cycle keeps on repeating several times at night. So there was a gentleman sitting behind me. He had a sleep study in 2018. His index is 23 per hour. So that means every night he quits breathing about 23 times per hour, and the normal is less than 5 per hour. So this is a perfect example for a 60-year-old female. You can see the airflow. There is a flattening of the airflow. Then the breathing picks up. So as soon as their airflow stops, their oxygen starts dropping, and that is a main reason patients have a lot of comorbid condition, mainly heart disease. So what are the symptoms of sleep apnea? So main one of the main symptoms is that you will be snoring at night, but all those who snore don't have sleep apnea. And then, as I told you, there will be breathing pauses during sleep, and this will be witnessed by your bed partner. Whoever is in the room can see that patient has quit breathing. And since their oxygen drops, their brain wakes them from their deep sleep. So there is a several times they are waking up from the deep sleep, and that's why they don't sleep sound. And next day they wake up tired, and the whole day they are very tired and sleepy. Also poor concentration, and also morning headaches because less oxygen goes to the brain. So they have morning headaches. So this is a schematic diagram of the uvula of your upper airway. As you can see, soft palate, uvula, and tongue. So the common myth in sleep apnea is that they have to be overweight, but that myth is no more there. Even a normal weight person can have sleep apnea. And it all depends on how the small airway is designed. If you have a thick tongue or base of the tongue, or you have any neurological problem like Down syndrome, any medical condition like hypothyroidism, that can predispose to sleep apnea. Also family history, so if father or mother has sleep apnea, the kids may have sleep apnea. So what are the risks of untreated sleep apnea? Since you are very sleepy, you will have motor vehicle accidents, your mood and memory will be impaired, you will have high blood pressure, irregular heart rhythm, and this is very, very important that recent cardiology literature says any new diagnosis of atrial fibrillation, they have to be screened for sleep apnea because this is one of the most common causes of new onset AFib. Also stroke and heart attack. So the gold standard treatment for sleep apnea for many years is first it was tracheostomy, but now we are using CPAP. The word C stands for continuous, P stands for pressure, continuous airway pressure. So this is a patient who is sleeping with this, and you can see is a big mass covering the nose and the mouth, and is connected to a machine called CPAP. But as you can see, it's very, very difficult for a sleep apnea patient to use this mask for the whole night. So for a long time we were researching what is another good alternative, where if you cannot use a CPAP, what can be the next alternative. This was also treatment oral appliance who have mild sleep apnea, but main problem is snoring. And they have several type of oral appliances. The main purpose of this appliance is that it moves the jaw forward. So there is an upper and a lower lip, and if you advance the lower lip, the jaw is pulled forward, and your airway space behind the tongue increases. There are some surgical options which is now obsolete. There is jaw surgery where they advance the mandible. Also they have tongue surgery, and also there are other laser surgeries, but this has not been proven to help sleep apnea patient in the long run. So now this is the main thing I wanted to discuss with you. This is a new innovation for sleep apnea treatment. where instead of using the heavy bulky mask, you use this small remote. That green button is to switch it on and that white button is to switch it off. And the way this works is, as this slide says, the patient can turn it on and off. There is a pause button, so in case in middle of the night, if you are up to take a bathroom break, you can pause it. And also you can adjust the stimulation up and down based on your sensitivity level. And this is a typical, way we download the data, how many hours the patient is using, how many times they pause it. So this comes from our iCloud. And these are the indications for choosing a patient for Inspire therapy. They have to be above 22 years of age. It's not indicated for a pediatric population. Your apnea hypopnea index is how many times you quit breathing should be between 15 and 65. And they should have failed a CPAP. Then only they are eligible for Inspire. And also appropriate airway anatomy. So how it works? I'll skip this slide. This is a schematic diagram. We activate the hypoglossal nerve. As you see, that nerve innervates the tongue, and we choose the fibers which make the tongue advance forward. And we put a small cuff around that nerve. And when you stimulate that nerve, the tongue moves forward. So that's the basic mechanism of treating sleep apnea with this device. So as you see, that is a schematic how they dissect the hypoglossal nerve and how they put a cuff. That blue color is a cuff which you put around it. Now this is a very good comparison where you can see when there is no stimulation, you can see the base of the tongue and the palate, they are almost closed. There is no air going down from that level. But as soon as you stimulate the hypoglossal nerve, you can see how the airway has opened wide enough for the air to go in. So the procedure is very safe. It is done by ENT surgeons in US. I don't know about India who is doing that. But basically we put that small pacemaker device just below the skin and below the collarbone. And it has a lead which goes to the hypoglossal nerve. And at night, as soon as you have apnea, that triggers that pacemaker device, and then you stimulate the hypoglossal nerve. And this is the way a patient is using that. So this is the device. A patient has full control on it. You don't have to move around with a big CPAP machine or a mask. This device can go into your pocket anywhere you're traveling. It does not need any electricity. And you can turn on and off and also adjust the voltage. It has been proven safety in the 75 peer review, significant reduction in apnea index, decreased snoring, increased daytime activity, and also reduced daytime sleepiness. And this is a comparison where you can see it has a 79% reduction in the apnea hypopnea index, which is the number of times you quit breathing. Based on the bed partners report, the snoring is reduced by 88%. And the main thing is the patient satisfaction. It has a high patient satisfaction because anybody who has used CPAP in this crowd knows how difficult and intolerant CPAP is when you are trying to use it for the whole night. And it has a high therapy adherence. That means people accept this therapy much more than CPAP and oral appliance. This is applicable to you. This is how commercial insurance are approving this. And basically that's the end of the slide. So, and one more summary, a take-home message, that people take snoring very lightly. Even in Indian community, they think, as we get old, we snore, but please make sure that this is a lot of comorbid condition, and nowadays very cheap diagnostic devices are available which you can take home. You wear it for 2 nights and it gives you a very accurate result. So you don't have to spend money to go into a sleep lab and get your diagnostic thing done. Thank you very much.